Hi, so welcome to Croydon Central Dental. I'm Dr. Tony Fang, the principal dentist of this clinic. When I started maybe 15 years ago, all we had was emergency dental care, day in and day out. And I started at the dental hospital in Melbourne. And then as time went on, technology just took over in dentistry, and there was just so many new things that we could now achieve for our patients. And the patients became more and more educated, and they were taking better care of their teeth. And as time went on, there was just so much opportunity to do more things that would improve their smile and confidence, and it just changed the nature of dentistry completely.
Welcome to Croydon Central Dental, Tony and Jen's beautiful new practice. Here we are in the reception area, just going to walk you through a few of the design features. A beautiful terrazzo slab that's just arrived over from Italy.
Process. We needed a piece of imaging equipment that captured the entire mouth, and we chose once again to go with a Sirona or orthofos machine. So this machine gives us basically a digital image of everything that integrates with our entire software suite and also our images that we take in the room. It's one of the most sort of detailed imaging machines that we've got. Very, very fancy technology here. It measures the size of the patient's head with these two temporal prongs. It measures sort of the size of the head and the forehead, and if you position it correctly, it's a really accurate and clear image that we can diagnose many things that we might have otherwise missed. The machine is particularly easy to use, and Ben from Sirona has been very kind also to come in and teach all our support staff as well. So I think the whole team will know how to use this, and that has been really a key to making the workflow work really well for us as well.
As you come in, we've got the dirty side, the clinical waste and general waste into the ultrasonic and scrubbing area. The workflow comes along, we've got your bagging area and dirty area before it goes into the autoclave. Clean hand sink and the tray storage over in the corner.
I suppose the main highlight of our sterilisation area is our Dentsply Sirona sterilisation machine. The best thing about this is that it tracks every single cycle and pretty much every instrument that comes through. You cannot put an instrument batch through without putting in your own unique identifying code, and it tracks who did it and who put the items through. So in line with the whole digital clinic setup, we decided that we would slowly integrate a production line as well as the record taking line. So in here, this is our lab, which we're now printing our own digital models here, and we have basically a 3D printer, and it's a fairly basic one to start, but we'll be evolving that as we proceed, as our business grows, and then possibly eventually some sort of milling machine in-house, most likely from Sirona as well. So here we have, from a very simple digital scan, we've been able to create, and this one is of our sales rep Ben from Sirona. We've been able to create a 3D model of his teeth And using this, we can plan out our case and make mouth guards and appliances directly here.
We're quite limited for space for joinery because of disability circulation to the doorway, so we do things like conceal all the PC and electrical equipment up in overhead cupboards, so you can utilise the easily accessible lower cupboards.
So when we designed this clinic, we try to integrate our cabinetry and joinery in a way that works really smoothly with all our staff, but also more importantly was easy to clean. And at the end of the day, we just close off all the drawers, and sometimes we come in the next day and there'd be dust, but with this design we're finding it to be super easy to clean. So Sam Russell from Croydon Dental did design and recommend that we hide our Heliodent intraoral X-ray unit in this cabinet here, just for the aesthetics, but also the hygiene reasons, and it wouldn't get knocked and we wouldn't accidentally touch it with dirty hands or anything like that. And having used the Heliodent now, we really appreciate how stable the arm has been. In past units, we've always had a little bit of drift or a little bit of movement even after placement, but this unit has been rock solid. The head of the unit is quite small and very light, and we will have our nursing and support staff take the x-rays, and some of them are quite small, and they've always commented on how easy it is to move this particular unit because how light the head is. So throughout the course of our design, the main thing was that we wanted everything to be very digital, as I believe that was the future of dentistry. So we now take for all our patients a new digital record which shows them exactly what their teeth are like, and we also demonstrate this and allow them to play with their own teeth on screen. Here we are with our Sirona Cineus. We always wanted to integrate all our technologies together and to make it seamless and quick. So the best thing about our system here with Sirona is that we have an intraoral camera that immediately after we pull down, it brings up the large image on a screen so the patients can see. The best thing about our system here with the Cineus is we found that during COVID times, it was one of the only chairs that integrated a hydrogen peroxide rinse with the water coming out of all the lines, so that we would explain that to patients and they'd really appreciate the increased safety and infection control that we had. So in line with this dental chair, the Cineus, the best thing that we found from an infection control point of view was that the sanitation process is an absolutely amazing function of this chair. So at the end of the day, with this unit here, the water tower, it's just so easy to basically process our instruments. And we put this line straight in and it does an automatic flush. And we would put every line in, and we just found that our nurses would save so much time, and that flush would be a couple of minutes and we could go and do something else. The integration is, when you think about it, something really simple, but it's something that you use every day. So over the course of this chair, it makes a huge difference. The other thing that we did find out was the fact that we could put our own water, or we could put a dosage of hydrogen peroxide through this unit here, which was great for protecting our patients against COVID-19. And also, we did have an issue with water quality in the mains recently, and we found that function to be indispensable. We've always been used to having switches in these little areas here where the suction units go. And now that it's like a touch sensitive component, it's just so much easier to clean. And we never get anything stuck inside there, which is something that he never sold us on, but I actually find that little feature to be amazing.